protocol and my results. Just in general, and Michael Gold touched on this a little bit when he was really discussing why are we doing more non-surgical things. That's basically because a lot of people are looking for non-surgical modalities. And just look at the statistics that ASPS published on how minimally invasive has shot up 605% over the past 18 years, whereas surgical facelifts or excisional surgeries are just 94%. So this is the platform that I use. It is a unique device. It's subdermal heating using radio frequency. It is not non-invasive. It is minimally invasive. The probe is in fact going under the skin, tightening the tissues. And this is something that is energy controlled by the user. So you are the one setting the internal temperature and the external temperature. It's bipolar radio frequency. And so I'm going to show an animation that's going to better describe this. But essentially you have a probe on the undersurface and also sensing temperature on the external surface of the skin. So there's two systems going on here, and it's communicating between those two. And as we saw with Dr. Kinney's lecture, we are shrinking fibers septae at temperatures of about 55 to 65 degrees Celsius. And if we get it up a little bit higher, I don't think you need to get to 70 degrees Celsius to melt fat, but you're certainly getting it more effectively at that temperature. I like radio frequency in my practice for many reasons. I'm a facial plastic surgeon. I'm in private practice by myself. I like to increase the menu of services for my patients, including non-surgical modalities. I think it's really versatile. You can do small areas of contouring. This is a small cannula, so we're not talking about something that's causing a lot of trauma to the tissues or collateral damage because it's with bipolar technology. And I think it does have some improved safety with the thermal control. We've seen this over and over again that it does contract the tissues that it is heating. And so we see this, that the before and after, it's actually contracted about 42%. So that kind of coincides with what I tell people. I say this is going to give you about 40 to 50% of a surgical result. And if you find that reasonable, then this may be the procedure for you, obviously with the right selected patient and skin tone. This fits into my practice because, again, not everyone wants a facelift. And for those that don't, you don't really want to lose that patient. I think it benefits you to keep them within the practice, offering them some type of modality that may work better for them at the time that they have. Expanding your menu of services. This is done under local anesthesia, so we're doing it right in the office. It takes about an hour and a half at most to do this. Patients are completely comfortable with the tumescent that I use and can drive themselves home. So I don't use any pre-medications. Nobody's ever called for any pain medications post-procedure, and they're really low maintenance. I mean, they are not calling in the middle of the night saying, why do I have this swelling? Naturally, they do have some swelling associated with this, but there's very little risk for things here. Can we play this? This is a really good animation that I think better describes the technology that this device uses. We can play it. If not, I'll just skip it. Whenever I find a good animation that really kind of clearly depicts what the technology is doing, I like to show it for those that have not seen it. So this is the probe. You can see how it's actually, there's the temperature sensor sensing an external temperature, the probe which is actually emitting the radio frequency energy and heat. They are both simultaneously sensing an external and internal temperature, shrinking the fibers septae as you are withdrawing the cannula. You kind of do this in a sort of W-shaped motion throughout the lower face and neck. I traditionally will treat all of my patients, not just the neck, but always the lower face as well. I always include it, contours the jawline in addition to their submental as well as the neck region. You can see this, the lipolysis that's occurring with this. And over time, you see sort of an instant tightening while you're doing this, which is quite transient as swelling takes over. And then over the course of about 6 to 12 weeks, you see gradual tightening. So my protocol, I actually do not infuse a lot of tumescent. This varies. I've been talking to some other dermatologists that have said they infuse with 120, 150 cc's. I just don't think that's necessary because you're really increasing the amount of energy that you need to put into the tissues to heat it up to the temperature you want it. So 60 to 75 cc's, more than appropriate for what I need for the entire lower face and neck. Completely sufficient anesthesia. 3 puncture sites, one on each preauricular area, and then one in the submental area. My internal probe setting is about 57. I'm getting a little bit savvy with it. I'm going up to 58, 59, but I feel that I can get a pretty good result with 57. And then I always have my external set to about 36 to 38 degrees. Can we play this video, please? So this is me doing I did this patient probably about a month ago, and she's completely awake. I just have her eyes covered so she's a little more comfortable. The probe is just going atraumatically. As I'm withdrawing, I'm actually, the heating is occurring in that sense. Here I am in the submentum. I take a little extra time in the submentum. Everyone's always got a little fat pad down there. So I always would like to kind of treat that as best I could. For some people that have a lot of fat down there, and I feel like there's going to be a lot of aspirate, that's melted fat, I do kind of do a tiny bit of liposuction just with a negative pressure syringe. I always tell them wait at least 4 to 6 months to see results. I can tell you people are seeing results faster than that. And they're actually calling the office saying, I can't believe you only charge that much for this procedure. I've had 2 people so far do that, so I'm thinking about that. And how long does it last? Always the question, but there's so many factors here. There's genetics, there's environmental factors, and there's the type of lifestyle. So I say, I like to believe 3 to 5 years. Beyond that, you may just be a repeat or a surgical candidate. So here's some results. This is 6 months, no lipo. Again, not a surgical result. I'm not selling this as a facelift. I'm selling this as this can get you about 40% of a facelift result. This is pretty darn good for something that takes an hour to do, contours the jawline and contours the submental area. This is someone 6 months after as well. You can see that just by the way the light is hitting her jawline, she's got more contouring, and some of that platysmal banding is contracted up. Now, we're not treating platysmal bands, don't confuse that. I didn't do like Dr. Kinney did where I actually treated the actual nerve, but I think the skin contraction helps to support the platysmal band a little bit more. Okay, so we're gonna switch gears. I have just a couple more slides, and this is a different type of technology that I have in the office. It's also stimulating collagen through dermal heating. This is with a tungsten lamp with a longer pulse duration. It's called the tite. Fairly effective for my patients. This is no downtime. You literally have to do about 2 to 3 treatments spaced about 4 weeks apart, and they can literally apply makeup right out the door with this. The concept is that this prolonged pulse duration is heating the tissues at a depth of 1 to 3 millimeters, and you know that at this depth that we are stimulating the collagen-producing cells. So you're shocking the collagen coils as we see here, and they are not only tightening and contracting, but forming thicker strands, and that translates to a thicker skin envelope. This is the treatment, pre-cooling. It heats depending on how much energy you're using for about 6 to 8 seconds, and then does 2 seconds of post-cooling. These are the results. Again, reasonable. You're not selling this as a surgery, but it's something that can really be effective for someone that's not ready for surgery. Thank you.